Dr. Jeff talks love. Dr. Jeff talks life. Answers your questions, cuts through the strife. Sex and intimacy, real and true. Evidence-based, made just for you.
Greetings. Welcome to Dr. Jeff Talks About Sex and Intimacy, where we explore evidence-based ways to improve your sexual health and to strengthen your amazing relationships. I'm your host, Dr. Jeff Albaugh. This is episode 76, a topical treatment for erectile dysfunction, Eroxon. So whether you're watching live or listening to the recording later, every moment of your amazing life matters, and I am truly grateful that you took time out of that amazing life to join me. You are really what this podcast is all about. We are connected across so many platforms. We are on Facebook, we're on YouTube, X, LinkedIn. If you are a Facebook person, do us a favor and follow us. The more people who follow us on Facebook, the more we can do on Facebook. And thank you to all of you for liking or following us on whatever platform it is that you use. Visit the website. You can go back and watch 75 different episodes on all kinds of topics with some of the greatest experts in the world. So you can watch previous episodes, pull up the calendar and see all the great podcast episodes we have coming up for you. Really exciting. I can't wait with all those different guests. So go to the website and learn more. We love it when you visit the website. You can take us where you're going. We are streaming on Spotify, Amazon Music, iHeartRadio. Take Dr. Jeff Talks About Sex when you're working out. Work out to it. Learn more about sex as you're working out. Take us on the road with your loved ones so everybody can learn more about sex, intimacy, and improving your relationships. What could be better than that? Take us along because we're streaming. As always, I'd like to take a moment to welcome you here. You are so welcome. This podcast was designed for you. Whatever your sexual orientation, your gender identity, or your relationship style, this space is yours. It was meant for you. It was designed for you. The mission of the podcast is really, really simple. It is to empower and enlighten you with the evidence-based information you need to make informed choices to help you have better sexual health, to deepen your loving relationships so that you can live your amazing, miraculous life more wholeheartedly and with more love. In today's solo episode, we're talking about Eroxon, a newer over-the-counter treatment for erectile dysfunction that's creating a lot of interest because of its fast-acting, non-pill approach, very different from other treatments. I'll walk you through how it works, what the research shows, and who may benefit from it, and how it compares to other erectile dysfunction treatments. We're going to discuss why erections are about more than just blood flow alone, and how communication and expectations, anxiety, and connection can all play in, and how you can integrate something like Eroxon into love play with your partner, which is what it's all about. So let's jump in. Eroxon. All right. Wow, what an exciting thing to have a new topical treatment. We've never had something that you put on the surface of the skin before that might help. This is a really, really exciting thing. So let's dive in further. All right, so Eroxon was approved and cleared by the FDA in June 2023. It is not like other medications, a prescription medication. It is the first approved topical treatment. It's actually a gel, and its indication is for erectile dysfunction. Now, it is applied directly to the penis, and it's designed to improve blood flow. And we'll talk about how it does that and to help you achieve and maintain erections. So, how does it work? Well, it's pretty simple. You just apply a small amount. It comes in a little tube, and that little tube that you get, that you see in the picture there, is actually one dose. So when you get your box, there's usually 4 doses in there, and that tube will give you that one dose. You are going to apply that gel to the head of your penis about 10 or 15 minutes before sex. Follow all the specific directions in there, but the onset of Eroxon typically happens within 10 minutes. It is designed to more rapidly give you that response. Now, remember, you have to take the pills about 30 to 60 minutes ahead of time because they won't peak and give you the full effect in your body for about an hour to an hour and a half after you take them because they have to be absorbed into your system. But this is quickly absorbed into your system, which is really important to remember. So this is a fast-acting topical gel. Now, what happens is it contains a proprietary combination of volatile solvents that evaporate quickly upon application. So we'll talk more about how that works in just a second. So here's one of the studies that reminds us that this is our first topical gel. There's a couple other things out there that they studied as well. But in this study, we had 250 men who had erectile dysfunction, and they had it for greater than 3 months. So this is men who've had the problem, and they've had it for a little while. 60% of them said they had an erection within 10 minutes. So the response happened within 10 minutes in over half the men. Over half the men said also that they had a minimally clinical important difference in their IIEF. That's the International Index of Erectile Function score. So what that means is they had a clinically significant change in their erections using this topical agent. That's pretty exciting. There's other trials as well. This is a multi-center trial in Europe with 1,000 men aged 18 to 70 with mild to severe erectile dysfunction, everywhere from mild, really, not a severe form of erectile dysfunction, all the way to where men didn't function at all. That's severe erectile dysfunction. So maybe the men with mild, how I would describe those men typically is they're having trouble. Maybe they can get an erection, but they have trouble maintaining. They kind of lose it midway through sometimes, or they've had intermittent problems. Men with severe erectile dysfunction, they've had erectile dysfunction. It's been going on for a while, and some of them get very little to no erection hardness, fullness, anything. So they split them into 4 arms, 3 active treatment arms with MD2005 gel at different doses. And then remember, Eroxon is MED 3000. That's what it was when it was in clinical trials. So the one group got the Eroxon, which is the MED 3000. But you're going to not hear it called Eroxon because it's not been approved yet and doesn't have that name yet when this study occurred. So they found that they demonstrated significant improvements in erectile dysfunction across all of those erectile dysfunction severities. It worked the best in the men with milder to moderate, but it did work across each of them somewhat. It was consistently effective to improve erectile function, both clinically and statistically significant. So we needed to see changes in scores that were statistically significant, but we also needed to see that the men felt that it made a difference and they were able to function better with it. And the best news is it has an excellent safety profile, with headache reported in 3% was one of the most common systemic ones. Also, some men got local irritation, things like that, but not many men had side effects, and very few thought men thought that there was any kind of side effect that would stop them from using this topical gel. Okay, so here is another trial, 24-week multi-center randomized open-label trial compared topically applied MED 3000 against the standard treatment, which is oral agents. These are phosphodiesterase type 5 inhibitors for erectile dysfunction. Things like sildenafil, trade name Viagra, tadalafil, trade name Cialis, Avanafil, these different PDE5 inhibitors. So they compared those. And they had 96 men with mild to severe erectile dysfunction, similar to the studies before. They were from the United States, Poland, Georgia, and Bulgaria. And the participants were required to be a part of the study. They had to attempt intercourse at least 4 times in the initial 4 weeks to establish baseline severity. So they had to try sex at least 4 times during the 4 weeks to see what was going on. The study met both co-primary endpoints. There were 2 endpoints that study. When we quantify your erectile dysfunction using a questionnaire that asks you about your erections, That's called the International Index of Erectile Function, and the EF stands for the erectile function domain of it. And they needed to see a statistically significant change in that number, that how your erectile dysfunction questionnaire score added up, that there was a statistic difference in that. And then also that it made it clinically important that you saw a change, that you were able to function better. That's what a clinically important difference is. So in conclusion, it significantly improved erectile function and was effective across all ED severities. It was supported by favorable safety, again, very little side effects or problems, with a small number of men reporting, and again, here we hear headaches, skin irritation, making it a viable topical treatment for erectile dysfunction. Because what the men find was very little side effects, and most of them tolerated it fine. And it helped, again, as you saw in the study, about 60% of men. So not everybody, but a fair amount. So lots of things to think about. I'm going to summarize that just a little bit. And what I'd like to say about it is that just remember, this is a fast-acting topical gel. It's applied to the glands, which is the head of the penis, approximately 10 minutes ahead of time, 10 to 15 minutes ahead of time. How does it work? How it works is it causes a brief cooling sensation on the skin of the penis, which is followed by a warming, because the blood comes in to warm, which stimulates sensory nerve endings in the glans penis. So it causes a cooling, which causes a warming on the surface where you put it topically. And that sensory activates, we believe that triggers nitric oxide, the release of nitric oxide, which is a potent chemical in your penis that causes the smooth muscle to open up and the blood to enter your penis and make you hard. So that cooling, heating thing that it does on the surface of your penis actually stimulates that nitric oxide, which causes the smooth muscle to relax away from the blood vessels to fill with blood, and that's how you get an erection with this Eroxon topical. One of the distinguishing things about it is that it has a rapid onset because it's topical. You don't ingest anything into your body. And that is really important to remember because it's totally different than any other treatment we have for erectile dysfunction. So Eroxon is really well tolerated. It has a great safety profile. If you have any weird problems with it, stop it. I always tell my patients, try it on your wrist first, because if you try it on your wrist and make sure you don't get a rash or any weird reaction to it, try just a little there, then you can put it on the head of your penis, because a rash on your wrist is a lot more forgiving than that rash on the head of your penis. So make sure you don't have a weird allergic reaction to it. And then if you try it and you have any kind of strange side effect, don't use it anymore. But most people tolerated it beautifully. The only systemic side effect really that was reported was headache, and that was about 3% or less. And then that skin irritation. So, and it worked in about 60% of men. That means it may not work for everybody, but it might work for you, and especially men with mild to moderate ED, but it even worked for some of the men with severe ED. It offers a totally different fast-acting topical treatment, and it hasn't been studied, but it also may provide something. Let's say Eroxon works somewhat in you, but not quite enough, and the pills work somewhat in you, but not quite enough. You could carefully try. There's not a lot of research trying them together, but you take the pill. Remember, you have to take that about an hour and a half ahead of time. And if it helps a little, and then you apply the Eroxon and it helps a little, maybe that joint therapy might help as well. You might need to use the vacuum pump as well and the bands to hold. So it might be used along with other things possibly as well. But it's exciting to think we have a brand new, wonderful treatment out there. Is it perfect? No. Does it work for everybody? No. But it does allow us to have a completely different novel treatment as well as the other current treatments that we have. So that's pretty exciting. So I would say, most importantly, what I'd like you to know is we have another treatment out there to try, and it might be something worth trying for you. It won't be covered by insurance because it's an over-the-counter. It's bought over the counter. It does not require a prescription. It is fast acting and it is topical. Pretty exciting. So I think that's a good thing. I'm going to go to our centering exercise, which we always do because that was a lot of scientific information. But as we always do, I'd like to go to our centering exercise as we move towards the close of this episode. I invite you to take a moment just for you. Take a moment just to breathe into yourself, to relax and breathe into the magnificent being that you are. Get in a comfortable position. If you want to put your feet flat on the floor, rest your arms or hands on your lap or to your side. Get comfortable. Then, if you feel any tension in your jaw, in your neck, and your back, release that tension as you exhale. So I'm going to have you inhale slowly to open up the space. And then I'm going to have you exhale through your mouth to clear any tension. And as you exhale, just feel yourself melt and release into that chair. Inhale in your nose and open, and exhale through your mouth and clear. Again, breathing in slowly and gently exhaling out your mouth, letting go of any tension you might carry and melting into that chair. Remind yourself that sexual health challenges and problems do not define your worth. They don't define you. They don't define your masculinity or your ability to experience closeness or intimacy. Healing and change often begin with curiosity, with compassion, self-compassion, and with connection. Allow yourself to silently repeat as you do that deep breathing in your nose and out your mouth. I am enough. I am worthy of intimacy and connection. I am worthy of intimacy and connection. I can approach my body patiently and with self-love. I can approach my body patiently and with self-love. Take one final slow breath in and gently exhale. Yes. And Vic will tell us what's coming up next week on Dr. Jeff Talks About Sex and Intimacy.
What if belonging didn't require leaving parts of yourself behind? In this Pride Month, Dr. Jeff is joined by Anne Russo. They explore a powerful and often overlooked path, one where LGBTQ+ individuals choose to remain within their faith and cultural communities, even when that journey is complex. At its heart, this episode speaks to a universal human need to be seen, valued, and included without having to sacrifice who we are. In a time of growing division and disconnection, this conversation invites us to reimagine what it means to create communities where there is truly a place for all of us. Join us on June 23rd at 7 p.m. Central Time to learn more.
Wow. So thank you for joining me to learn about Eroxon, the new novel topical thing. It's been around a couple of years, but maybe you didn't know about it. And I hope that information was helpful and that it might be something that you can decide, is it right for you or not? Nothing's right for everybody. That's your decision. And next week, and I just would like to really remind you, I'm so excited to be presenting here in Pride Month to you. And we have 2 episodes. The 2 last episodes of the month are dedicated to all my LGBTQ plus population out there. This is your podcast, and you are so welcome here. And know that you are amazing, you are beautiful, and don't let anyone tell you different. Thank you so much for joining us to learn more about Eroxon. And I hope whatever your struggles are, that you find what you need to live your best, most wholehearted, magnificent life. Thank you.
Dr. Jeff talks about sex